Hello everyone, I'm Tanya, a public health nurse here in Ilocos Sur. This episode of Unleash Speaks will give you insights from healthcare workers from different parts of the Philippines. Let us listen to what they have to say regarding the public health and COVID-19 pandemic.
Good day everyone, I am Joflorin Cristal Regalado from the Provincial Health Office of Camarines Sur. The COVID-19 pandemic has been a great challenge to every Filipino in the past year. This has caused drastic changes in our everyday living. And we are continuing to adjust to the new normal way. We Filipinos have proven our ability to move forward despite every challenges and crisis that has come our way. We focused ourselves in practicing the minimum health standards and protocols that were given by our government. It might be difficult at first, but it is very important that we follow these protocols. As a frontliner since March 2020, we have been concentrating on the prevention and detection of this unseen enemy. I was personally assigned as a swabber in our province. We were trained to do so. We were the ones to test those symptomatics, those LSIs, and with exposure to COVID patients. At first, I am not used to it. Ang hirap. Parang bago kasi siya hindi tayo sanay. Wearing mask, wearing PPEs, wearing face shields, and everything. Ang hirap as a nurse. Kasi hindi naman natin yan ginagawa araw-araw. Hindi ko rin alam kung after 4 days straight duty, pag uwi ko, nadala ko ba yung sakit sa bahay namin? Or asymptomatic lang ba ako? Nahawa na ba ako ng iba kong katrabaho? Or nahawa ba ako nung naswab ko? It is very difficult. And so, dumating isang araw na aming kinakatakutan. One of our colleagues got infected with COVID-19. We were all shocked. We were all crying, thinking, saan niya nakuha yung sakit? Hindi ba siya naprotektahan ng PPE habang siya ay nagsaswab? Or nahawaan niya na ba kami? Kasi magkakasama kami sa isang lugar. It is very hard to think, where is that unseen enemy? The longest 14 days of our lives has started. Plus 3 days pa kasi hinintay pa namin yung negative swab result bago kami payagang umuwi. We were locked in an hotel room for 17 days. Pero, hindi yun nagtatapos doon. Sabi nga nila, life must go on. And bilang mga nurse, ito ang aming sinumpaan. Kahit nagkaroon ang aming katrabaho ng sakit na ito, kailangan pa ring bumalik at bumangon. Ang mga taong nagkakaroon ng COVID-19, lalo na po ang ating mga kapwa frontliners, ay hindi natin dapat iwasan. Pagkos, lalo natin dapat silang mahalin at hangaan sa kanilang tibay at lakas ng loob na labanan ang sakit na ito. After ng 14 days, balik ng trabaho, nagpahinga ng konti pero balik pa rin ng trabaho. That is a frontliner. My job as a frontliner doesn't end as a swabber. At the same time, I am the National Immunization Program Coordinator for the province of Camarines Sur. One of the most important developments in our fight against this pandemic is the development of the COVID-19 vaccines at a speedy time. Napakabilis kasi in a span of 1 year nagkaroon agad tayo ng bakuna. But there is no cure and none of the vaccines that are being developed have been proven to prevent the transmission. These vaccines will still serve a very important purpose. This may prevent from spreading the disease. This may reduce the deaths caused by this disease. So it is very important. Habang ang ating mga eksperto ay patuloy na pinag-aaralan ang mga bakunang ito, kailangan nating sumunod at magtiwala sa ating gobyerno. Kailangan nating bigyan ng pagkakataon ang mga bakunang ito upang tayo ay mailigtas, upang mabawasan ang mga buhay na mawala ng dahil sa sakit na ito. As I've said earlier, combating the COVID-19 pandemic requires whole-of-a-nation approach. Kailangan po nating magkipagtulungan sa ating gobyerno, sa ating komunidad upang labanan ang pandemyang ito. While these vaccines is among the solution, Nevertheless, this is not the only solution to end this pandemic. We still have to adhere to the minimum health standards required of us. We still have to stay healthy, exercise regularly, and drink a lot of water. Muli po, mula sa probinsya ng Camarines Sur, Bicol Region, marami pong salamat and please keep safe everyone. Thank you!
Hello everyone, my name is Maricris Mangiduyos from the CAB RHO and Birding Station, Nueva Ecija, Region 3, Philippines, a public health nurse. We are frontliners. Public health nurses and rural health workers are among the few and select contingents in the COVID-19 firing line. Bakit ko sinasabing ang public health nurses at rural health workers ay kasama sa unang pila sa larangan ng digmaan laban sa COVID-19? Sapagkat sa panahon natin ngayon at sa kasalukuyang kalagayan ng ating bansa, marami tayong mga kababayan na natatakot magpa-ospital sa pag-aakala na sila ay mahahawa ng ibang sakit o makategorize as COVID-19 suspect. Kaya ang public health nurses at rural health workers ang unang humaharap, nag-aaruga at nag-a-assess sa mga pasyente sa community upang ito ay mabigyan ng pangunahing lunas o mai-transfer sa hospital kung kinakailangan. COVID-19 is highly infectious. Direct exposure to a person with the disease poses a real risk of being contaminated. Ito ba ay nakakatakot? Bilang nurse na laging nasa harap ng panganib, kami ay lubhang takot na mahawahan. Takot para sa sarili, takot para sa aming mga kaanak, takot para sa aming mga kaibigan na lagi namin nakakasalamuha, at takot para sa mga pasyenteng aming nakakaharap sa araw-araw. Thank God, we have PPEs. But have you experienced the inconvenience and discomfort of wearing one? Oppressively inconvenient and uncomfortable. Kaya habang wala pang bakuna, ang takot ay palaging nandoon. Takot ng pagkahawa, tuwing kami ay haharap sa mga pasyenteng pinangangambahang may sakit na COVID o may sintomas ng COVID-19. Tuwing kami ay magsasagawa ng tracking procedures, patient monitoring and contact tracing. Tuwing kami ay magtutungo sa iba't ibang hospital para mag-transfer ng pasyente, kami ay inaalihan ng takot. But as nurses, this is the kind of occupation we opted for. We do not regret that decision. On the contrary, we are exceedingly proud and honored to be nurses. But we hope people would recognize the danger we face daily. We hope they would not demonstrate any act of discrimination or avoidance of nurses because of our being constantly exposed to the risk of COVID-19 infection. Don't worry. We take extreme care of ourselves. Tunay na mapanganib ang profession ng nursing, lalo na ngayong panahon ng pandemya. Ngunit may feeling of excitement and fulfillment din ang nadarama namin bilang nasa unang pila ng laban ng COVID-19. For my part, I am happy being a nurse. I am proud being a frontliner. I will not trade places with anyone. I will have it no other way. Bring more dangers on. Let's go.
Tayong mga public health workers ay sanay na sanay sa mahirap na trabaho. Ulan, baha, matinding sikat ng araw. Kayang-kaya nating lahat yan. Wala tayong sinasanto. Difficult terrains? Okay lang yan. We find ways and means to reach our target population to give the much-needed health services. Then dumating si COVID. Paano na to? Di natin alam ang ating gagawin. Ako po si Christine Lim, isang nurse ng City Health Office ng Zamboanga City. When the pandemic started, I was immediately assigned sa COVID Operation Center. Walang orientation, walang guide, walang script, basta sinabi, "O Christine, ikaw na maunang mag-duty sa OPSEN. Tutal, hepo ka naman." Sanay na sanay kang makipag-usap sa mga tao. Answering calls from people who are frantic, afraid, anxious, confused. and even at times angry is not an easy task. I am also part of the team who went around the city to monitor and check and to evaluate the readiness of our lying-ins and health centers, ensuring they put in place the infection prevention and control measures. Ang pinakamalaking challenge that we are still facing is still ang pagpapaintindi sa mga tao na we need to practice and observe the minimum public health standards. Hindi pa po tapos ang pandemic, nakaisang taon na po tayo. Because behavior change doesn't happen overnight. The job of the risk communication continues. Kaya dapat hindi tayo magsawang magpapaalala sa mga tao na kailangan nating mag-observe ng minimum public health standard. Still, keep safe, take care, and as we say here in Zamboanga, tiene cuidado.
Good morning! Hello po, magandang umaga. Ako po si JL Junicio ng Aklan Provincial Health Office. Ngayon po pupunta po kami sa Malay kung nasaan po doon ang Boracay Island. Ngayon po ay gagawa kami ng on-site monitoring for the Chikiting Ligtas Campaign 2021 ng ating Provincial Health Office. So ngayon po 6:30 in the morning, medyo namumugto pa po ang ating mga mata dahil gumising po tayo ng maaga para lang po pupunta po sa isla ng Boracay. So 2 hours po yung magiging biyahe natin. So medyo matagal po siya. 2 oras po tayo na nasa sasakyan. Nakakasama ko po yung ating mga kasama ko sa Provincial Health Office na mga monitors. Pero may mga kanya-kanya po kaming mga assigned municipalities. Papakilala po kayo ngayon. Mamaya po. Araw ko po ngayon, itutour ko po kayo sa kung ano pong ginagawa ko bilang public health nurse dito sa probinsya ng Aklan, which is part po doon ay ang on-site monitoring tsaka pagbibigay po ng technical assistance po sa ating mga nurses, midwives in the field. So mamaya po makikilala nyo po sila. Dahil po pumunta po tayo sa isla ng Boracay, it is very important to have your own QR code. Opo, so yan po ay part ng contact tracing sa isla ng Boracay. So pwede po kayong pumunta sa touristboracay.com, aklan.gov.ph to access your own QR code. So gagawa po ako ngayon, ipapakita ko po sa inyo kung ano itsura po ng QR code na ating gagamitin po para makapasok sa isla ng Boracay. Must remember po yun. And then, I have my own mask while waiting for sa mga kasama ko na darating mamaya. Update ko po kayo. Sana po mag-enjoy kayo sa trabaho ko dito sa Aklan Provincial Office as Public Health Nurse. Yahoo! Yes! Hello po! Dito po si Mama Donna. Ang aming kasama po yan sa ating health service. Siya po isang nutritionist dietitian. Magmo-monitor po kami mamaya, kasama po siya sa ating Chikiting Ligtas campaign. So dito po kami ngayon kasalukuyan sa registration area po. So kanya nakikita nyo po. Ayan. Jet Deport. So we are just waiting for the confirmation and we're good to go. Yes. Medyo malakas pong alo, no? Yun, no? Gumagalaw. Ayun, no? Oh my God. Oh my God. Oh my God. Ito pong ating ginagawa, no? Risking our lives just to Do monitoring. We're here. Yes, sir. We're here. White sand. Face shield is a must. Face shield is a must. So, andito na po tayo ngayon sa Yapa Covered Court. Isa pong area for the vaccination for Chikiting Ligtas campaign. So, we are just waiting po for our municipal health team para mag-umpisa na po ang ating vaccination. Ayan po ang ating mga... Hello, ma'am! Good morning!
Good morning!
Yan, ready na po ang mga kabataan. So, mamaya po ay makakatanggap na sila ng kanilang mga booster doses ng polio, rubella at tigdas. Yan. Po, no? So, kasalukuyan pong nagaganap ang vaccination for the Chikiting Ligtas. Medyo kailangan lang nating ayusin yung social distancing doon sa bandang yon. So, pupuntahan po natin sila maya-maya. So, may nakita po tayo kanina na mga barangay officials na nag-assist to manage social distancing. So, ayusin po natin doon mamaya.
Pagdaw ka sa lamesa, magantad ka mo.
Mga tad-antad.
Ay, delikado.
Social distancing, social distancing. Yan.
Tumang
Ayan po, yun. So, yung social distancing, medyo naayos na din. Yun, social distancing. Distancing po tayo. So, thank you so much sa ating mga partners from the PNP. Ayan, dito po. Yun. Ayan, keep coming, keep coming. Sige po, punta po kayo dito para sa ating libreng serbisyo. Para po sa inyong mga anak. Keep coming, everyone. Oh, after po ng vaccination is the finger markings. Galit, galit. Galit, galit, galit. Oo.
Hi, Mai!
Congratulations, Mai! So we are also seeing partners from the PNP. Sir, thank you sir ha. Thank you for helping at mga partners from PNP. Thank you din. Sir Jer and team, say hi, smile. Everybody, kabang mo ma'am, 1, 2, 3. Okay, thank you po Sir Jer, bye-bye. And we are done po. Tapos na tayo sa ating 3 vaccination teams na napuntahan kanina sa Kapitlan. So ngayon, babalik na tayo sa port and time to go. So meron tayong mga monitoring na ginawa sa proper vaccination, how they were able to encourage parents to submit their children for vaccination, and provide technical assistance po. So, ang ating pong kampanya ay isimula ngayong February hanggang February. Month-long po yan na vaccination coverage kontra tigdas, rubella at polio. Bilang safety protocol po dito sa isla ng Boracay, mandatory po ang wearing of face shield and face mask. So medyo masaya po maging public health nurse kasi marami po kayong mga knowledge na natututunan. Pwede nyo rin siyang ma-share sa community. Challenging siya kasi kailangan mong i-encourage yung mga nanay na pabakunahan yung kanilang mga anak. Trabaho natin yun sa public health, no, na magkaroon sila ng tiwala sa ating mga programa, maging vaccination man yan, nutrition program, o family planning. So kahit ano po, medyo iba yung challenge na bit-bit ng public health. Kung ikaw naman ay nasa ospital, kanya-kanya yan silang mga challenges, but for the public health, yun po yung ating kakaiba doon. Yes sir. Yan. So ngayon po, pabalik na tayo sa ating boat. Yan po yung isla. So medyo hindi muna tayo pupunta ng isla kasi hindi yun yung pinunta natin dito. Monitoring tayo. So pero syempre babalik tayo sa isla soon to enjoy. So good afternoon po. Ito po ang ating Provincial Health Office Aklan at katabi po niya ang DOH Office. Hello ma'am. Ito po ang ating Admin Office sa PHO Aklan. Kaway-kaway naman dyan. Okay. Then diretso tayo. Ito po ang ating Hospital Management Office. Hello everyone! And other rooms for the PHO. So dito po usually nagaganap yung mga data validation and data na pumapasok galing sa ating mga municipalities. So ito po ang room for the program coordinators. Ito po ang ating National Immunization, Chikiting Ligtas, coverage. So from the field, dito po lahat yan, pumupunta ang kanilang mga data and coverage since day 1 until the end of the campaign. So dito po natin sila kina-consolidate and ina-analyze for re-strategy. And the different coordinators. So currently wala sila ngayon dito kasi nasa monitoring sila. Yan. Then pag galing sa field, didiretso tayo sa ating mga data. So hindi po nagtatapos sa field work ang ating trabaho because chine-check po natin lahat ng accomplishments ng ating municipalities and barangays if nagagawa po ng mabuti po ang ating immunization program, the Chikiting Ligtas. So, we are doing analysis, the projection, and yung mga current standing ng ating mga LGUs. So, part ng ating monitoring sa public health is yung pag-analyze ng mga data for strategies and new activities na ikakandak natin. So we also analyze data ranking ng per municipalities as to the measles and oral polio vaccine coverage. And also part ng ating task sa public health is to analyze the data and present sa ating mga stakeholders yung mga nakikita natin sa field, mga good practices, and yung mga recommendations like based sa actual coverage. So ginagawa din natin yan sa public health. So not just activities but yung pwede pa nilang i-improve sa kanilang mga ginagawang vaccination. So ito, I am making a slide na pwedeng i-recommend natin sa kanilang mga mayors based sa nakita natin sa field. So, trabaho yan natin sa public health. So, after po natin na pumunta sa field for the vaccination, dito po ang consolidation ng ating mga data dito sa Provincial Health Office. So, siya po si Ma'am Jinky. Ma'am Jinky, hello! Siya po ang ating in charge for the encoding ng ating mga vaccination coverage sa field. So, nasa mga kamay ni Ma'am Jinky ang kapalaran ng mga municipalities. So, yan po ang ating ginagawa dito sa public health. Okay man, Ma'am Jinky? Okay man so far? Yes. Okay, thank you, Ma'am Jinky. At ipapakilala ko din kayo sa ilan sa mga program managers natin dito sa PHO na kasama natin sa monitoring. So, si Ma'am Maricel, ang isa sa mga monitors natin sa field. So, kamusta man, Ma'am Maricel, ang implementation ng immunization sa iyong mga barangay?
Okay man, we'll be going there this around 1 o'clock sa siya.
Nice. So,
may makonduct sila MROP PSA sa holiday.
Okay, nice. Thank you so much. So,
Make up lang.
task ng monitoring natin yan sa field. Thank you, Ma'am Maricel. So, from one coordinator to another coordinator, si Ma'am Pej, yung nurse 3 namin dito sa PHO, kamusta, Ma'am, yung implementation ng immunization sa inyong assigned area, Ma'am?
Well, I can say that our implementation there in my assigned area is leading.
Wow.
On the 6th day, naka-reach na kami ng 54% OPV and MR.
Yes, so si Ma'am Pej, ang kanyang area ang leading sa ating mga municipalities. So, maganda na nakikita ni Ma'am Pej yung implementation nila sa field para ma-share din natin sa ibang LGUs.
Yes.
Yeah, thank you, Ma'am Pej.
Bye!
At saka itlog. Hindi po yung coordinator. Itlog. Immunization day, mga kaibigan! Grabe! Grabing ulan! That's so hard, mga kaibigan. Grabe, ulan! Say hi to the vlog! Sanay ka sa ulan, galing, no? Grabe itong ulan.
Meron kami mabaligit na, sir.
Ano, ma'am?
Meron kami mabaligit na.
Okay lang, oo. Uli uman kami. Ginahimos naman naman. Thank you, ma'am, ha? Sabi ang mga sita na, oo. Basang-basa sa ulan. For the Ticketing Ligtas campaign ng ating Department of Health, mga kaibigan. Maulan dito sa Aklan. Maulan dito sa Aklan, mga kaibigan. Let me show you the Aklan River. Yan, Aklan River. Yan, o. Ayan, o. Mataas na po ang tubig at araw-araw po dito ay umuulan, but still our health workers are here providing services to our children, protection for tigdas, polio, and rubella. Our barangay health workers and our municipal health office staff is doing the immunization for the Ticketing Ligtas. Yes, it's raining hard. It's raining hard. Pang-8 araw na namin to, but still, walang tigil ang ulan dito sa Aklan. And the Aklan River, you can see, hindi nyo ba makita pa doon sa kabila? Dito sa kabila. Basa. Bye-bye! It's raining hard here in Libacao, ladies and gentlemen. But the health team is game na game. Smile, maskin basa! Smile, maskin basa! And I'm back! Kakagaling lang po namin sa isa sa mga pinakamalayong municipality sa probinsya ng Aklan, ang Municipality of Libacao. Napansin po natin doon yung concern nila sa weather. Ilan lang po yan sa mga concerns na kinakaharap ng ating mga health workers na nasa field. Weather, yung perception ng tao sa mga health services natin, yung distance, yung availability of health services. Yan po ay ilan sa mga nakikita natin ng mga concerns pagdating po sa public health. So nakita natin kanina yung lakas ng ulan. Pero kahit malakas yung ulan, ginawa pa rin ng ating mga health workers na gawin yung trabaho nila sa vaccination para lamang makapagbigay ng magandang coverage po sa kanilang municipality. So yun po yung isa sa mga ini-enjoy natin dito sa public health, yung mga ganong experience na hindi nararanasan ng iilan, no? At yun po yung maipagmamayabang natin once in-expose mo po yung life mo as nurse po as public health nurse. So ako po ay nagagalak dahil na-experience ko po yung mga ganitong mga karanasan na para mas mapagyabong pa natin yung ating skills, knowledge, and attitude. KSA, attitude pagdating po sa public health. From the field, diretso po natin yan dito sa PHO. Lahat po ng mga data, binavalidate, and binimake sure na sakto yung mga impormasyon na natatanggap natin bago natin yan i-discuss, pagplanuhan, and re-strategize. Yun po, no, sa mga nurses natin na gusto i-try yung ating world of public health. Medyo mahirap lang siya, pero masaya and fulfilling. So maraming salamat po sa pagbibigay po sa akin ng chance, Tanya, na maibahagi ko din po yung public health experience ko dito sa Provincial Health Office ng Aklan. Maraming salamat and hope to see you again soon. Thank you!
Assalamualaikum warahmatullahi ta'ala wabarakatuh. Greetings of peace and prosperity from the province of Lanao del Norte. I am Laila, Nurse 1 under the HRH Deployment Program of the Department of Health. When the Honorable President Rodrigo Roa Duterte declared the public health emergency last March 16, 2020, lahat ng pamahalang lokal ay sumunod, including the province of Lanao del Norte. Ang pandemya na po ito ay nagdulot ng walang kasiguraduhan sa buhay ng mga tao, hindi lamang sa Pilipinas kundi sa buong mundo. Mula nung unang kaso sa Manila last January 2020, kumalat na ang confirmed cases to around 422,000 and in northern Mindanao, nagkaroon po ng mahigit 6,000 cases. And in the province of Lanao del Norte, creation of incident management team and interagency task force was done. IMT po ay is a group of trained personnel which responds to disasters and emergencies para ma-manage yung logistical, planning, and community issues related to COVID-19. Sila ang magbibigay ng command and management na kakailanganin. The IMT has been so strong and proactive in its response, considering hindi lang yung health and well-being ng mga tao, kundi pati na rin yung socio-economic ng probinsya. And so, yung Interagency Task Force served as the advisory of IMT and responding appropriately, timely, the needs of the people, and also in embracing the new normal. And as the pandemic looms in the locality, nag-declare po yung ibang LGU ng ECQ to MECQ to GCQ. And there are municipalities na nag-lockdown po, and also installation of isolation facilities sa Mindanao Civic Center para ma-accommodate po yung mga LSIs, ROFs, and those who were positive sa rapid test. And also yung mga trainings para sa contact tracers, swabbers, and health personnel on COVID-19 were also provided. Pag-encourage sa mga LGU to install isolation facilities para kung may halimbawa may mga kaso sila sa kanilang locality, mayroon silang isolation facility doon mismo. The most important, significant interventions of all was the creation of the first ever LGU-funded molecular laboratory in the region which is located sa Kapatagan, Lanao del Norte, which became operational last September 2020. As a frontliner stationed in Provincial DOH office, my task and role was more focused on providing technical assistance and guidance to my co-HRH and assistance to DMO Force and DMO 5. And so, ang pandemya na po ito is parang roller coaster na sobrang daming challenges and difficulties. Una, andyan niya fake news, yung mahirap i-contain yung confirmed cases at yung mga level 1 affected, at yung shortage ng PPEs para sa ating mga contact tracers, ating mga swabbers, and para sa isolation facilities and hospital staff. And also yung issuances ng medical certificate, kasi pahirapan talaga yung labas sa locality kung walang medical certificate. Kakulangan sa manpower and submission of ASAP reports. But at the end of the day, happiness and fulfillment to serve made it worthy, and I am grateful po to the Almighty that among the millions of people in the country, I am given the opportunity to work and serve the humanity. Buhil as one.
Hi, I am Bernardita F. Hontucan, but everybody calls me Penchi. Isa po akong public health nurse ng Isabela City Health Office Technical Working Group and the designated Health and Education Promotion Officer. Isabela City is a component city in the province of Basilan. Even before the pandemic, health, education, and well-being of her constituents was the 8th in the 9-point agenda of our new administration, Mayor City Jalia Turabin Hataman. She allocated huge portion of the city's budget to City Health Office. So tinutukan talaga ng bagong administrasyon ang kalusugan, edukasyon at kapakanan ng bawat mamamayan dito sa lalawigan ng Isabela. The year 2020 was a challenging year for all of us. We are faced to fight the invisible enemy, ang COVID-19 pandemya. As early as February of 2020, nagkaroon ng pulong ang lahat ng mga leaders namin upang pagplanuhin ang novel coronavirus local action plan para makatugon sa hamon na dala nito. Pagpapatupad at pagsunod sa minimum health standards sa buong probinsya ang pinapanukala ng pamahalaan. One thing good that COVID-19 has brought to us was the strengthened collaboration and cooperation on service delivery network among leaders and stakeholders. Pagkakaisa ng adhikain kung paano masugpo ang COVID-19 upang maging ligtas at mapalayo ang bawat isa sa kapahamakang dulot nito. Since ang lugar po namin ay surrounded with bodies of water, securing our ports and boundaries from entries of backdoor of undocumented LSIs from Holo, Tawi-Tawi, Zamboanga City, and Sabah, Malaysia was one of our priority. Task Force Jaga was created to closely work with the City Health Office on securing our ports for undocumented LSIs. For City Health Office, we collaborated with DOH9, Nagdila Foundation, and Rich Health USAID in the series of training for health workers. We started with the orientation of our city health personnel on the right information about COVID-19 and trained the swabbers, disinfection and sanitizing team, and contact tracers on infection control. We also capacitated at Barangay Health Emergency Response Teams, Barangay Information Officers Network, and DILG hired contact tracers on contact tracing and risk communication. In our journey during this pandemic, we frontliners experienced discrimination from the community. Ang iba po namin mga kasama pinapalayas sa mga nirerentahang boarding houses. Hindi pinapasok sa sariling barangay, hindi pasasakayin sa tricycle, Hindi bebentahan sa mga sari-sari store sa barangay. And worse, nakakarinig pa sila ng mga hindi kanais-nais na mga salita from the community people. Nakarating sa aming Mayora City Jalia Turabin Hataman ang mga ranasang diskriminasyon ng mga frontliners. Kaya nagbigay siya ng direktiba sa City Information Office na ma-launch ng search for the top 10 Isabida frontliners upang maipakita ang hard work and sacrifice themselves just to prevent the spread of the disease. Maraming ang naantig ang mga puso sa mga kwento ng mga frontliners. Dito nila na-realize ang mga sakripisyong ginagawa ng mga frontliners sa komunidad, kung saan patuloy na nagbibigay ng taus-pusong serbisyo upang maging ligtas at mapalayo ang bawat isa sa COVID-19. Dito na-feature ang barangay tanod, nurses in the birthing, isolation and quarantine facilities, the swab team, the disinfection and sanitizing team, the barangay health workers, barangay nutrition scholars, the CDRRMO volunteers, and garbage collectors. When posted on social media, we received praises and extended their gratitude for all the hard works and sacrifices we have done. Kaagapay namin ang City Information Office sa mga advocacies on COVID-19 gamit ang pitch-in na IEC materials being produced by their office and Bida Solution campaign sa 45 barangays ng Isabela City. Bida Solution campaign was also repeatedly played every hour in our local radio station, the DXNO 97.5 FM Radio Comunidad, where it can reach almost all the municipalities in the province of Basilan and in some parts in Zamboanga City. Ang ating mga frontliners ay mga tao rin, napapagod at natatakot na posibleng tamaan din sila ng COVID. Sa halip, katakutan, ating tulungan at pangalagaan ang ating mga frontliners sa pamamagitan ng pagsunod sa public minimum health protocols na pinapatupad ng ating pamahalaan. Ang pananatili sa bahay ay malaking bagay upang mapigilan ang paghawa ng COVID-19 at mapagaan ang pagpasan na hatid nito sa ating mga frontliners. Sa kasalukuyan, puspusan ang paghahanda namin para sa COVID-19 demand generation and communication orientations to increase COVID-19 vaccination acceptance. Nakasalalay sa pagtutulungan ng bawat isa ang tagumpay natin sa laban na ito. Kaya pagkakaisa, respeto at pagmamahal sa ating ibandila laban sa COVID-19. Sama-sama nating sugpuin ang COVID-19 para maging happy, mabuhay tayong lahat.
And there you have it. These are some of the people who belong to an amazing group of frontline heroes called public health nurses. Ang mga public health care workers natin ang nagmamonitor ng crucial health status indicators like environmentally caused illnesses, immunization levels, infant mortality rates, maternal mortality rates, and communicable disease occurrence para ma-identify ang problems na makakabanta sa kalusugan ng komunidad at sila din ang nagbibigay ng interventions para malutasan o mabawasan ang mga insidenteng ito. Ang mga programa na hawak po ng public health ay patuloy pa din na pinapatupad kahit bumabagyo o may pandemya. Public health programs will care for every individual from womb to tomb, the community, and the environment. Kakaibang challenge ang maging isang public healthcare worker, but all the same, they are also modern-day heroes. I would like to thank all of our friends who sent their messages. Thank you for sharing your opinions and point of views. We certainly learned a lot from you. And for those who also want to give their video message, don't hesitate to contact me. For details and instructions, like our Facebook page and message us via Messenger at Unleashed by Provincial Health Office of Ilocos Sur-IDU. Hope to hear from you guys soon! At sana naman may natutunan kayo sa episode na ito. At kung anumang kalaman ng ating natutunan, magandang ipamahagi din natin ang mga ito sa ating mga mahal sa buhay. If you have any comments, questions, or suggestions, leave us a message in our comment box down below. Don't forget to hit that subscribe button, like, and ring our bell to get notifications of new Unleashed episodes. Thank you for watching. Once again, this is your public health nurse, Tanya. See you on our next episode. Bye!